Well, welcome to the Dr. Youn Show. This is another Hot Topics episode where I am joined by my good friend, dermatologist Dr. Emily Levin.
Hello.
Thank you for joining me. And we're going to be
here.
talking all about the hottest topics in cosmetic medicine and plastic surgery today. We're going to talk about Meghan Trainor and a treatment that she has recently had. We're going to talk about how you can now change the color of your eyes, and is that safe? And we're going to talk all about the biggest plastic surgery cosmetic medicine trends in 2025. So this will be interesting because, as you know, I'm sure if you follow me, I'm a plastic surgeon. Dr. Emily Levin is a dermatologist. For those people who haven't heard you on the podcast before, I think this is your fourth or fifth time. Can you just tell us about your practice and your background so that they can get a little acquainted with you?
Yep. I am a dermatologist in private practice in the suburbs of Detroit in Michigan. And I've been in practice for about 20 years. Grew up in this area, a big fan of this area, as I'm wearing my Lions sweater today.
Hey,
The Lions of the Detroit Lions doing well, have a big game. And I mainly practice general dermatology, surgical dermatology. I have a medical spa. I do some cosmetic work as well. And I just love it.
Good,
Yeah.
good. Has there been anything interesting in your practice going on? I think it's been about a month or so since we got together.
Yeah.
Any new news? I think last time we were talking, you and I were kind of complaining about my M-Sculpt and your cool sculpting. What's new in your practice nowadays?
Well, ironically, just this morning I read that I also have an all-therapy device. We were talking last time how M-Sculpt came out with the M-Sculpt Neo and made the old device sort of obsolete. And same thing with the Cool Sculpting, came out with Cool Sculpting Elite. And now all-therapy has come out with a new special all-therapy. I'm blanking on the name of it, but some all-therapy ultra.
I was going to say
that is
Premier,
making, something like that.
Better all-therapy,
right.
or
that is gonna
better
be,
than the old one.
Yeah, so they're not going to be selling their cartridges for the old machine anymore as well. I
not gonna sell
literally
them?
read that this morning. Nope.
So you can't even use it.
So I'm going to need your advice on eBay how to sell both my all-therapy and maybe Cool Sculpting. That's still a workhorse for us, and we use it a lot.
So all-therapy basically is a skin tightening treatment that uses ultrasound energy to target the deeper skin. The idea behind it is that you use that ultrasound energy, the same energy that you use to, let's say, look at a baby inside a woman's tummy, but you turn that energy way up and you can heat the deep skin. You bypass the surface of the skin. So unlike, let's say, a fractional laser, you're not damaging the surface of the skin. You're just heating up the deep skin. And so, you know, it's one of those, I have looked at all therapy in the past. I've referred many patients to your office because I think for many years it was the gold standard for non-invasive skin tightening.
Yep.
But my concern was always patient satisfaction. And it's like I saw patients who had all therapy, and some of them, you could see they definitely had a distinct tightening of their face. And oftentimes it's in the neck area. But then other patients I talked to said, oh my gosh, it hurts so much. And I saw zero change in it. And I spent, $2,000 or whatever on it. What did you find with all therapy? Was your patient satisfaction rate, do you feel, with that device?
I would say, and that's interesting because I was thinking about that this morning, that it really is like anything else, picking the perfect candidate for all therapy. People that have significant facial sagging or collagen sagging, it just doesn't do much. I tell people you get a 2 to 4 millimeter lift. So for someone in their 30s, 40s, 50s that just needs a little bit of tightening, I actually saw great results. And I've done it on my own, my own face. I get a little eye tightening and an eye lift every year. I usually every few years I do it.
It's actually FDA approved for the forehead
It
first.
works great for that. Like if you don't have a ton of sagging, if you have a lot of sagging, very minimal results. They're very minimally noticeable, and people were disappointed. But man, does it hurt. Like we got the Pronox machine, which is a nitrous gas, like they have at the dentist, to use specifically and we offer it complimentary with all therapy because it is so painful. I mean, really, even myself who can tolerate a lot of pain, it's incredibly,
is it tough?
Almost intolerable.
Yeah,
so you really have to do it in small stages.
Can you just turn the machine down and do a less aggressive treatment?
Yes,
then?
but it's not as effective. And
even
even with the mildly, the less intense energy levels, it still hurts.
Oh, is it really?
It hurts.
Oh, interesting.
It hurts a lot more than needles.
So a lot of doctors are using Pronox in their practices now to help patients, when they're getting injections or getting treatments. What do you find the Pronox is helping for in your practice other than the L-therapy?
Yeah, it's great. We do it for PRP injections as well. So we have a lot of patients that come in for hair rejuvenation with PRP, which is platelet-rich plasma, and that hurts. A lot of people, it's hard to tolerate. You get, 20 to 30 pokes in your scalp of a needle and that pressure of injecting the PRP. So we use it a lot for that. And some people just request it for filler injections, for, any type of injection, anything, quite honestly. And for some laser treatments as well, but mainly for now, PRP and all therapy are the two main things we use it for.
Are you using it much? Because you do radiofrequency microneedling in your practice too, right?
That's what I'll call it Pixelate, but yes.
Yeah. Do you use it for that as well?
That we can use topical numbing cream. You know, therapy kind of bypasses the surface, so the numbing cream doesn't help for that.
Yeah.
So that's where we really need it for. But no, the radiofrequency microneedling, people can tolerate really well. And I've had that done again myself. And as long as you put numbing cream on before, very tolerable.
We had a rep come to the office just the other day because we are interested in bringing in exosomes to the practice. I think we talked a little bit about it last time. And one of the things I've seen some dermatologists do is I've seen them microneedling the scalp and then applying the exosomes on top of it as an onlay. And then, when we were talking to the rep, they were talking about how some people were using radiofrequency microneedling for the scalp and then doing that with the exosomes. Is that something, have you done any of that, or have you heard much about that?
We used to do microneedling before we had the radiofrequency device, just a little EpiPen, or not the EpiPen, what was it called? Skin pen.
Yeah.
It was a little microneedling device without radiofrequency. And we used to do like PRP where we kind of squirt it onto the scalp and then microneedle it in.
Yeah.
But injecting it seems to work better for us. So we sort of moved away from the onlay, as you said. But I'd be very curious to see how that works.
Yeah, the exosomes, you wonder if that would be an easier option for people and whether that truly does help.
Yeah.
You wonder with microneedling it, and especially if you use it almost like a lube type of thing when you're applying it as lubrication, and now you're microneedling it. Technically, you're probably pushing some of it into the scalp, even though it's technically illegal to inject exosomes. It's not illegal to apply exosomes.
Right.
And so then the question is are you kind of getting by that by using the microneedling because it's going so superficial?
Yeah, you're not injecting it.
Does it get a better result? Does it get a better result than, let's say, injecting PRP, which is completely legal, obviously? It would be an easier treatment, that's for sure, to have done, as you're saying that you need the Pronox. But so something we're starting to look at, and we may actually test it out on myself. We'll see.
I'm happy to be a model as well. Feel free if you want to test it on me or my skin. I'm happy to try it.
Yeah, well, it's definitely an exciting time in plastic surgery. We're going to be covering some of the biggest plastic surgery trends of 2025. We're going to get to that in a little bit because that's going to be quite a lot of information that I think is going to be a lot of fun for you and I to dissect through. But before we do that, a couple of quick stories. The first one is Meghan Trainor. Meghan Trainor, famous singer. She's sang all about the bass.
And My Lips Are Moving, which is interesting in this case, actually, because it's the irony. That was a song of hers, Lips Are Moving.
So here's a story of Meghan Trainor, My Lips Are Moving. She's opening up about a recent facial procedure that didn't turn out as she had hoped. In an episode of the podcast Working On It, which she co-hosts with her brother Ryan Trainor, the singer candidly discussed her experience with botulinum toxin, widely known as Botox. To all my fellow girlies out there who are in your 30s, hi, she told the audience. I got too much Botox and I need help. The All About That bass singer said she had had Botox injections, which are often used to smooth wrinkles, a handful of times in various parts of her face. She described opting for a lip flip procedure, which uses Botox to relax the upper lip and make it appear fuller in order to give her little lips a boost. It was not true, Trainor said, adding that as a result of the Botox, she now has trouble moving her face. I cannot smile anymore, she said. Everywhere I go, I cannot smile. According to the Cleveland Clinic, lip flips can also cause drooling and difficulty speaking if the Botox is injected too close to a person's mouth. So you do the lip flip. I think we have mentioned it here on the podcast before. How can you do a lip flip and then you literally can't smile anymore? It doesn't make sense to me. What do you think happened to her?
They probably, the placement, either it migrated a little bit or the placement was such that it, hit the levator superior labri or whatever, the muscle pulling up.
Labii superioris. Yeah.
Yeah, I know the Latin gets me every time. But where which allows you to kind of lift up your lip. Lip flip, and I do them all the time in my office. I have and people love them. Some people love them. The trade-off, and I've tried them on myself. I do not like doing a lip flip on myself personally.
Oh, really?
Because you cannot, you're relaxing the muscles in your upper and lower lip, which is when you purse, that's what's causing those fine lines on the mouth. So it's kind of a double-edged sword because you have to relax the muscles, but then you can't purse your lips very tightly, nor can you, smile very large or brighten, or close up. So when I brush my teeth, I have to hold my lip closed when I do the lip flip, and I hate it. People, either love that and they love having the lip flip and they like the look of it and they don't mind that side effect of it, but it's always a side effect. It relaxes that upper lip.
How many units do you put in the lip flip when you do it then?
Baby Botox. I do baby amounts, and I usually start with just the upper, and usually with Botox, I would
Yeah.
use 8 units, usually 8.
Okay.
If it's Dysport, it's 20 units, but which is a very small amount. And then
Yeah.
some people come back and are like, too much. So I'll do 4 units, and other times people come back and say, I want more, and I want my lower lip, and I'll do 12 altogether around the mouth.
Do you find the lip flip works for the lower lip pretty well?
It really helps. It doesn't flip it like the upper lip when
Yeah,
you smile
exactly.
flips it, but it does relax the fine lines, that cause from pursing.
Yeah.
So, but again, the trade-off is that you often can't, you can't
move your
purse.
mouth that
yeah,
well,
and there's
yeah.
certain letters that are difficult to say when you're brushing your teeth, and so it's
I
tough.
feel so. We do lip flip here in my office. I do it occasionally. I don't inject probably nearly as much as you do, but what I usually do is about just 5 units in the upper lip, so 2.5 ish at each top of the cupid's bow of the
Mm-hmm.
lip, and typically I find that seems to work nicely. It wears off,
Yep.
within a couple months, unfortunately.
Yeah, it does wear off quickly.
But it's different. I feel like the lip flip is different than injecting the mouth for mouth wrinkles. That I think is different, because if you do the lip flip, at least the way we do it here, it's just literally two tiny little pokes right at the cupid's bow.
Yep.
And then if you want, you can also do 2 tiny ones maybe in the lower lip, but
Yep.
it's not necessarily made for the actual vertical lip lines.
Yeah,
And
that's
then I
true.
think you have to do more extensive Botox.
That is correct.
And I mean, when you do the actual lip lines, are you doing more of an extended lip flip?
Yeah.
Essentially?
A couple extra pokes around, so
Yeah.
you got to go. You have to follow their lip lines where they
Yeah.
are and where the muscles are contracting. But
Yeah.
that is true. When we do a lip flip, we just do a little bit. We kind of go in,
Yeah.
we go down kind of from the up, and we inject a little bit right in
Exactly.
the cupid's bow or outside.
Yeah.
But still, you still can't tighten your lip super tightly.
much,
So
yeah.
she either had too much Meghan Trainor, a
Sounds
little
like
too
it.
much, or it was placed in an area where.
So she may have had more than just a lip flip, but is maybe adding a little more to try to.
Yeah.
Yeah. And you know what? Sometimes, we don't know who injected her, but it could be a more novice injector. And there's a big celebrity that comes in and you're just like, oh, I want to get them this great result. And
Right.
so maybe you let some of that kind of take hold. You're like, oh, it'd be so great to get her this amazing result. And you do too much. And now it's backfired.
Yep, it has
Yeah.
backfired. But the good news is it wears off like
Yeah.
like always, and she can go back to her moving
Yeah,
lips.
I think the lip flip, I agree with you. I think it's a great treatment. I think we don't here in the office, and I taught my injectors essentially not to. We don't inject for the vertical lip lines because that exact reason
Yep.
is because the mouth moves weird. It doesn't move this like
It isn't-
normally, and most people don't like that so much. And so whenever somebody wants that, we typically refer out. We say, hey, look, there's this other injector who likes to do it. And
Yeah.
just so that we don't have to deal with the
I don't blame
complaining,
you.
honestly.
I'm happy to do it. It's just about communication with the patient.
Yeah.
I always tell them, like, communicate with me. Let it settle in for 2 weeks. If it was too much, too little, let's take a look at it. And they do, and then it's kind of nice. We can find a nice balance.
Yeah.
So I enjoy doing it.
So this next story is interesting, and it has nothing to do with either plastic surgery or dermatology, but it is a cosmetic treatment. Jason Jimenez had brown eyes when he walked into a New York clinic last month. When he emerged a few hours later, they were light gray. The 39-year-old real estate agent is among a growing number of people who have permanently changed their eye color through cosmetic surgery. Many doctors say the surgery hasn't been proven safe and warn it could cause lasting damage. To lighten Jimenez's eyes, Dr. Alexander Mavshovich used a laser to cut donut-like tunnels into his corneas, the clear outermost layer. The surgeon used a tool to widen the tunnels before filling them with dye. The procedure, known as keratopigmentation or corneal tattooing, was completed in about a half hour. The effect was immediate. I'm so bad at this name. Mavshovich is among a few U.S. doctors who offer the procedure. He treated about 15 keratopigmentation patients in his first year. This year, he is on track to treat some 400 people. He said he charges $12,000 per surgery. It isn't covered by insurance. $12,000 for a half-hour treatment. My God. The American Academy of Ophthalmology warned patients in January that cosmetic keratopigmentation carries serious risks for vision loss and other complications, including light sensitivity and bacterial or fungal infection. The safest way to lighten the appearance of eyes is with prescription contact lenses, the Academy said. 12 out of 40 cosmetic keratopigmentation patients in a 2021 study published in the journal Cornea complained of temporary light sensitivity. 5 said the pigments had faded or changed in color. 1 who had previously had LASIK developed a condition that caused their corneas to thin and bulge. Dr. Brian Boxer-Wackler, a corneal specialist who has performed cosmetic keratopigmentation in LA since the beginning of 2024, said there were no published reports of cosmetic keratopigmentation causing infection. There are also no reports, he said, of vision loss in people with no previous history of LASIK. Pigments used for keratopigmentation haven't been approved by the FDA for use in the eyes. Keratopigmentation is irreversible. I'm so bad with the name. Mavshovich invented a technique that can remove some pigment soon after surgery, but patients can't return to their original eye color. So essentially, these doctors, and I actually know Dr. Brian Boxer-Wackler fairly well. He was a big TikTok doctor, and so we're friends. And I saw that he's been posting a lot about doing these corneal pigmentation procedures. It sounds pretty scary to me.
Terrifies me.
Now, have you had LASIK?
I was just going to say, I feel a little hypocritical because I have had LASIK.
I've had LASIK too.
Yeah, okay, uh-oh.
Yeah,
but like,
yeah.
and I was terrified because that's your eyes. That's your livelihood. That's your, especially for you and I, our careers.
Yeah,
I mean, that was everything.
yeah.
But I felt I was in good hands and I couldn't see without putting glasses or contacts
Yeah.
on. So it was like a necessity for me, or, obviously convenience, and I have to do that every day. But this was not a cosmetic thing to get the LASIK done. And it was very successful. And I can still see 20 years ago as when I had it, I can still see
Yeah.
2015, which is incredible.
Do you need glasses at all?
Mild reading glasses, like for like late at night
Yeah.
when my eyes are
That's
tired,
it.
but not for distance at all.
Yeah,
Like
yeah.
20 years later. So I'm
Yeah.
a big fan of that.
Yeah.
This terrifies me. I mean, just
You're
put
come on,
some,
they're making tiny hole tunnels into your cornea and then filling that up with dye.
like, put some contacts in, for goodness sake. Like, just put some color. Then you can change the color. You can, what if you change your mind on this one? Like, you can't.
No, you can't go back.
This mild removal thing does. I mean, that's your eyes. Like, what? God forbid it make you blind or light sensitive for the rest of your life. Like, that's yikes.
I mean, eye stuff is scary overall.
Agree.
Yeah, I mean, I had LASIK. My eyes were really bad. To the point where I think I was like a -7 or 8 diopters.
Wow.
And I had my 2 kids, and I came to the realization that, okay, what's my most important thing in life is to protect my children, to make sure my children are taken care of. And I realized that, geez, if I get in a car accident or if it's in the middle of the night and somebody breaks into my house and my glasses fall on the ground, I am completely helpless. I literally, if I was to try to read something, my eyes were so bad, I would have to read with one eye at a time, because if I put the sheet of paper or the book at a distance where both my eyes could see, they couldn't actually see that far.
Wow.
It was that bad. Or if I would drop the soap like in a shower, it's just a big blur. So I decided, I was like, you know what? I'm going to take this actual risk and have this procedure done, because the number one thing I need to make sure I can do is I can take care of my kids if they need me. And so as a surgeon, I said, well, my eyes are really bad. And he said, well, why don't we do LASIK on you? LASEK.
That's what I had.
Okay, so that's where
Right on the surface.
you just burn it from the surface down. And the idea is that your cornea is only so thick. And if you are, and if your eyes are really, really bad, then they have to essentially burn a lot more of the cornea off or reshape it. And if your cornea gets too thin, then it starts to deform in shape, which is what happened, it sounds like, to one of these patients in that study.
Yep.
So I had LASIK done one eye at a time. My first one, it developed this weird astigmatism. It didn't heal right.
Ooh.
And it was blurry. And then I had one eye that wasn't seeing that well, and then the other eye that was horrible, like because my vision was terrible, but I hadn't done it. And probably for about 3 or 4 months, I couldn't see great through that eye. I had to wear a contact lens in that one. That was a hard contact lens to try to reshape the cornea. It was a mess. And then all of a sudden one day I woke up and I could see fine out of it. It was weird.
That's crazy.
Yeah, something had like healed. There was, I think, some epithelialization, some tissue that had grown on the surface as it healed, and it must have sloughed off and everything smoothed out and I could actually see fine. And then I had my other eye done 6 months later with LASIK, because the guy's like, I don't want to do the LASIK. It didn't work. Let's just do LASIK, and we'll take the risk if your cornea is a little bit too thin. And I was like, fine, let's do it. And it's worked out fine for me too. I mean,
But I bet you're not jumping to get your eye color changed with this one, because
but
I'm not.
I think the whole thing was, it's not like for me it was literally like I'm doing this because I want to make not it's nice not to wear glasses and stuff, but if I didn't have kids, I don't know that I would have proceeded with it. I just would go with contacts and stuff. That's fine.
I mean, I think a lot of the things we talk about here, it's like things are reversible, right? Like a lot of even surgical things are reversible. A lot of Botox and fillers and things are reversible. This one does not seem reversible
It's
to
not
me.
reversible. Yeah.
Yeah, so
well,
that's
you can
like
go
an
blind from
absolute no.
Well, and I,
That's a
I know
big fat
Brian.
no
Brian's
for
a good
me.
guy, Dr. Baxter-Wackler, and I'm sure he's doing a good job with it. But the fact is, it's like, hey, there's no published reports of problems and this and that. But there's 40 patients. Like this is not, we're not talking, tons
Hundreds and
tons.
thousands. Yeah.
Yeah. And when somebody's making $12,000 a procedure for a half-hour procedure, you're doing 400 of them in 1 year. How much is that? 400 times 12,000? Was that like $4.5 million?
Yeah.
Yeah. I mean, there's a lot of money to be made doing that, in which case...
But,
there's a monetary incentive, and does it push you to do things that maybe, aren't as safe? Yeah. So, definitely exercise caution. This is a type procedure I, in general, would not recommend.
Nor would I.
I don't recommend jumping to the newest thing right away.
Agree.
Let other people be the guinea pigs and give that time to make sure that it's truly a safe procedure. Because how many procedures have come and gone in medicine where people jump on and say, oh, this is great. And then 5 years later, it's like, yeah, we're not doing this anymore.
Yeah, or there's a side effect 5 years later. There's long-term side effects that happen. And again, irreversible. So this is a no thank you for me.
What if you find out that you're allergic to that dye afterwards?
Right. There's so many things. What if? I mean, I have a friend that's an ophthalmologist and she doesn't like me using Latisse, which is that stuff you paint on your eye to make your lashes longer. Doesn't go in your eye. She doesn't even like that. I can imagine running this one by her.
With that too, I've had concerns with that just because of the hollowing of the fat reduction loss.
With Latisse?
So, the periorbital fat loss.
I have not seen that, nor have I experienced. I've been using it for 15 years since it's been out.
We've
been using
been
it.
selling it for a long time, but I have considered not, because there are more and more reports of periorbital fat loss, of people losing fat around their eyes. It's a very well-known complication of it.
Really?
Oh, yeah. And more people are sharing that they're seeing that. I have puffiness under my eyes, so I'm considering doing Latisse.
I was going to say, most people come to me with fat pads under their eyes they want gone.
You're going to be like, why are your lashes so long, Tony? That's like, oh, yeah. But
no more
my
fat
puffiness
pads.
is gone.
Yeah.
All right,
interesting. I'll have to look into that.
We're at the end of the year, and so there's interesting articles that are coming out about, hey, what's going to happen in plastic surgery and cosmetic medicine in 2025. So I wanted to pull one from, I think this is from Allure magazine. This is quite long. It has a lot of really interesting things, and I really find this interesting because I wanted to chat with you about it. Being a dermatologist, they interviewed plastic surgeons about what they believe will be the biggest plastic surgery trends of 2025. Let me just go a little bit through it, and then we'll talk about each one of these. So I think it's really fascinating. And for those of you who are watching and listening, this is some of every year, plastic surgeons will make predictions of what you're going to see in the upcoming year. And this is basically these predictions, and we'll see if we agree with it. All right, so it's being basically what they're saying is that we are fundamentally changing. There's a massive shift in how we approach aging and plastic surgery. It's being fueled in part by menopause hitting Gen Xers who don't want to look quote-unquote matronly and are signing up for breast lifts, implant removals or swaps, and liposuction. Says Stephen Teitelbaum, MD. He's a plastic surgeon in Santa Monica. It's being propelled also by Ozempic, that diet fad to end all diet fads, which has arguably shoved skinny back into the national conscience. I think the filler market has seen its peak, says Stephen Williams, MD. There's a huge fear now of fillers lasting too long and distorting your skin, says Melissa Doft, MD, a plastic surgeon as well. So I think that's going to be the trend for 2025. Less is more in fillers. We're getting away from distortion towards more natural. All right, so here are the list of trends we will see, they say, in 2025. Brow lifts are back with a smidge of Botox. 5 years ago, brow lifts were dead. Nobody was doing them because everybody was doing Botox, says Julius Few, a board-certified plastic surgeon in Chicago. Nobody wants the Botox forehead, and there are plenty of examples of them running around in pop culture. Frozen foreheads, weird foreheads, demonic-looking brow elevation. That's Botox, and Xeomin and Dysport induced, says Dr. Few. Instead of lifting the entire brow area like they used to before Botox existed, they can now lift just the lateral portion of the brows, between the arches and the temples, while using Botox in between the brows in the 11 lines. I still think Botox is the best treatment for the middle, explains Dr. Few. You don't want to surgically release that area or the brows go up and you look surprised or weird. But if you lift the outer half of the brows, that looks really, really nice. You can transform the way somebody's eye area looks. This technique is called a temporal brow lift. And another reason it's gaining steam, it only requires 2 relatively small incisions hidden in the hairline. The older technique, known as the endoscopic brow lift, entails 5 incisions in the hairline. So what do you think, Dr. Levin? Are brow lifts back and Botox brows, people aren't doing them anymore? They're basically claiming that that everybody's ditching the Botox in the forehead for brow lifts. Are you having your patients tell you that, hey, I'm done with Botox in the forehead, let me do brow lifts?
No, and this may be a really unpopular opinion, but I don't buy these trends in like Botox is, it's all about looking your best self all the time. So with in the right hands and the right amounts in small quantities over time, I think people can stay looking their most natural selves. And I don't think Botox, brow lift has to do with how much heaviness and sagging you have. At some point, as you age, Botox can only do so much, and you just end up needing a brow lift because that's, maybe not needing it, but that would be the only thing that would really give you enough of a lift. I've always, not even in a trendy standpoint, done things where I've given a little bit of an outer brow lift for people using Botox, and then avoiding the peaked eyebrows. Again, those are bad results of Botox. Those are people in the wrong hands, that are getting arched brows and heavy foreheads. It's just...
Yeah. How often do you refer people for actual surgical brow lifts in your practice?
I would say actually about 25% of people that come in and ask me for Botox, I will be completely honest, as I know you are as well, with my patients, and say, Botox is not going to help you. You have this heavy forehead that if I do, Botox relaxes. We keep reminding ourselves that. And if you relax somebody's forehead from that frontalis muscle that's lifting their eyes up, it's going to make them look heavier. Exactly. So it's someone already has that heavy appearance. Botox is going to make it worse. And you have to be a good enough practitioner and an honest enough practitioner to tell people that. So I'm going to say about 25% of people that say, I'm here for Botox, and they're 80. I'm saying, nah, Botox isn't going to help.
Yeah, it's interesting because when I started my practice 20 years ago, I probably did 6 to 10 brow lifts a year. And then it got to the point now in the last several years, I was doing just a couple at the most. And so I ended up leaving my hospital, Beaumont, about a year ago, and they have all the endoscopic equipment there. So I just stopped doing brow lifts. I just told my patients I'm just not doing them anymore because I don't have the equipment for it.
Yeah.
But I had so little interest in it that it really hasn't affected my practice at all. And so I don't know. I'm not, here Dr. Few says that he says, let's see, 5 years ago, he maybe would have performed 5 brow lifts an entire year, which I see that. Now he says he performed 7 brow lifts in the last 3 weeks. So I don't know what he's seeing, but I'm not seeing that.
Well, and then, I refer to you all the time, obviously, but in this scenario, like I often refer to an oculoplastic surgeon because those are the people that, so who knows if that's really people wanting it less or wanting it more, or is it more of,
and honestly, a temporal brow lift, I don't think that surgery works very well. That's my thing.
And you can get an outer eye lift with just a little Botox around the periorbital, area where you can just give a nice little outside lift. But yeah, I've continuously referred people for brow lifts over the years. It has not increased or decreased if Botox is not the right thing for them.
And the way I describe it to patients is if you are wondering like, okay, what can Botox do and what can a brow lift do? What I explain to them is I say, hey, okay, look in the mirror at yourself, go home, look straight ahead in the mirror, and then just take your fingers and lift your entire brow up on both sides. If you lift the whole brow up on both sides, that's a surgical brow lift. The whole brow lifts up. And if that's what you're looking for, then that's a true surgical brow lift. If it, however, makes you look surprised and not like yourself, then you probably aren't a good candidate for a surgical brow lift. A Botox brow lift, I explain, is not the whole brow elevating, but it's where you have the arch. And if you elevate that arch, that you can do with Botox, but not the whole thing. And it's that middle portion of the brow that elevates with a surgical brow lift that does not elevate with a Botox version of the brow lift.
Yeah.
And I guess I would disagree. I know Dr. Few, really nice guy. I guess I would disagree that I don't think that that it looks weird to have that portion of the brow elevated. Once again, I don't do brow lifts anymore, so it's not, I'm not sticking up for an operation I do. But I actually think in some people that looks really nice to have that area elevated for them. Because if you truly have what we call real ptosis, where things are just, everything is low, then to elevate the entire brow can really be a big, nice change for people.
I agree.
But I agree. I'm not seeing it as necessarily a trend at this point.
Agreed.
I still think that Botox by far is the king of all that, and I'm not seeing more people coming in.
Yeah, but about the right candidate. As again, the candidate.
Okay, so here's another one. A prediction is that fuller faces and facial fat grafting will replace chiseled cheeks. Instead of taking fat out of the cheeks via buccal fat removal or injecting filler to create more sculptural cheekbones, more and more patients are putting fat into their faces. It can be used to plump areas that lose fat with age, like the temples, tear troughs, and the cheeks. Many of my patients love fat grafting. When I perform liposuction, I often repurpose the fat in the face or the chest to increase cleavage, says Dr. Doft, who I think is that's a double board certified plastic surgeon. So are you having patients tell you that, hey, essentially what they're saying is that people are afraid of filler, they're not doing fillers so much anymore for volume, but they're wanting fat instead?
No. So that one, again, like is not doesn't seem to feel like it's a trend for me. People want replacement of volume, period. Whether it's with fat, whether it's with filler. I don't do fat replacement. I'd be curious to know. I have had a lot of patients that have come to me and had fat grafting done. Which we always joke, take fat out of here and put it here. Like we always would love that idea. Take it here,
or
put it here.
People joke like, oh, you're taking fat out of this liposuction patient. Yeah, give it to me.
Give it to me and put it in my boobs or whatever, all the time. So that's a fun joke. But like I've seen a lot of people that have had fat grafting done on their faces where it falls. It doesn't stay in the right place and it falls into little pockets. And I've had a couple patients. So I don't do fat grafting myself, but with fillers, like, we've talked about, I can get really great volume replacement with just the hyaluronic acid fillers that I use. And not have I seen an increase or a decrease in that. It's always just been people come in, their face is starting to hollow out, sag, whatever, and I can give them a little bit of a lift and a little bit of a volume replacement with fillers. And that's always been, and again, the chiseled cheeks and this and that, it's all about the placement and looking natural and being in someone's hands that's you trust to make you look natural.
Have you heard from a lot of your patients that they have had buccal fat removal surgery at all?
I've read about it as a trend, but I've not heard from any of my, on the contrary, patients are coming, they want, sculpture, you can fill out those cheeks really nice, the hollowness of the cheeks. And with now this Ozempic face that, we're another trend that we may talk about or whatever is, people want the replacement more than the removal.
Yeah. Articles like this, you wonder too, when they're interviewing plastic surgeons, where we do mainly surgery, but we also do some injections. One of the recurring themes of this article is people are going to give up their non-invasive or less invasive procedures and have surgery. And so you got to wonder, like, okay, is this prediction a true prediction or is it more of a desire?
Right.
Like, hey, if I say it, maybe it will come true. Because as surgeons, we make a lot more money if we operate on somebody than if we inject a couple syringes of filler. Yep. And so how much of this is kind of wishful thinking versus a true actual prediction of a trend? All right. So the next prediction is that fillers will give way to scalpels along the jawline. I mean, once again, so there are so many energy devices that promise to tighten the area and injectors who want to lift it with filler. That jaws and jowls are more in the conversation than ever. But a lot of said devices don't give the dramatic results patients hope for, and attempting to correct jowls with filler can require so much filler that it ends up looking off. People are getting frustrated with the non-invasive stuff, like thermage or ultherapy, says Dr. Doft. And they're finding that filler's expensive, it's bulky looking, and there's a huge fear now of fillers lasting too long in your skin and not going away, and distorting your skin forever. We'll touch on that in just a little bit. It has a lot of people questioning whether they want to continue down the path with filler. Many people are kind of saying that surgery is going to be the ultimate end goal, so why am I spending all of this other money? Says Dr. Doft. And that brings us to more patients asking about facelifts for tightening their jawlines. Many of them are relatively young, in their mid-40s and early 50s. So, I mean, what are your thoughts? We did talk a lot about ultherapy and the fact that it does seem to work for the right candidate. But once you have a certain amount of looseness, it's too much for a device like that to handle.
Absolutely.
And what they're saying basically is that people are going to go and they're having surgery possibly at younger ages. This is something that I have not been seeing in my practice necessarily, but I'm also conservative. I discourage people who are on the younger side of having a facelift because it creates permanent scars. Scars are in front of and behind the ears, usually a scar underneath the chin. 3.5 hour surgery, is it really worth doing that to your face when you're that age? Have you had patients who are in their, let's say, 30s and 40s ask about, hey, what do you think about me getting a facelift?
Yeah, I have. I mean, and again, most of the time there's not enough sagging at that age, for them to really need it. But we talk a little bit about the pros and cons of surgery versus, and there's so many things you can't fix saggy jowls with filler. You really can't. Like if there is saggy jowls, you can sculpt someone's jawline a little bit if they kind of have a sunken chin and a sunken jawline. You can sculpt that out a little bit with filler, but you certainly cannot fix heavy hound doggy, faces like that in the saggy jowls, which is a common complaint that I get. So you have that conversation with the patient. I'm like, okay, well, you're 45 and, is it really worth it? Like the only thing that's going to make a big difference is surgical, like a jaw, surgical lower facelift. Yeah. But they're like, I'm not ready. And I said, are you really ready for that 45? So it's really, again, it's all about the patient and like what but I have not noticed an uptick in patients asking, but you certainly cannot, you have to just, again, be honest. You can't fix heavy jowls with filler. Mm-hmm. And while you could have surgery and that would give you a dramatic improvement, all therapy's not going to fix it, or thermage. But are they really willing to do surgery at 45? I mean, it's an ethical conundrum a little bit,
And I firmly believe that you can do up to two facelifts in a lifetime. When you hit 3, you start worrying about scar tissue, about the tissue not looking natural and all that. And that's one thing I do talk to my patients about is like, and I do a lot of facelifts. I did one today. I did one on Tuesday. And really I tell patients that you really want to space these out. If you have a facelift when you're 40 years old, you're going to probably want to have another one by the time you're in your early to mid 50s because they don't last longer than 10, 15 years at the longest. Now you've already had 2 and you're still in your mid 50s. Like, are you going to have a third one when you're in your mid 60s? And at that point, I mean, the skin and the tissue can only take so much before it starts not looking right.
It looks weird. And we've all seen people that have had one too many facelifts that, it's not normal looking.
So the next prediction is the art of filler damage control will evolve. Fillers have been a national experiment for the last 20 years. That's a quote from one of the doctors.
This guy is really anti-filler.
Those consequences can look like surface irregularities, areas of depression and elevation in the skin, especially around the mouth, says Dr. Moffitt. Moffitt, I think, also is a plastic surgeon. He is noticing these changes in patients who started getting filler in their mid-20s and are now in their 40s. At some point in a person's life, they decide they're going to have all of the filler removed. And when they do that, it's kind of a shocking thing to them because now they look haggard, says Dr. Moffitt. I've seen a number of patients who have gone down that road, and in my personal opinion, they're probably worse off today than they would have been if they had done nothing at all. He typically corrects the damage using facial fat grafting. It's my belief that when hyaluronic acid filler has been removed with hyaluronidase, that is an enzyme that will melt filler away, there is volume loss in excess of what that person had before anything was injected. There may be a role for microfat and nanofat to restore that, basically stating that if you remove filler, you actually lose more than what was initially injected because hyaluronic acid is a naturally occurring substance in our skin. 15 years ago, I would have kicked any 40-year-old who was thinking about a facelift out of my office, says Dr. Few, but now he's seeing 40-year-olds who have been overfilled and actually need a facelift. I do blame a handful of individuals on the medical side that have been proponents of mega filler sessions, putting in 20 syringes of filler in one session. That is absolutely ludicrous and produces side effects we're now dealing with. So a couple things that they brought up here.
Chomping at the bit.
That I think would be, interesting for us to talk about. First of all, you have people who are in their mid-20s, they're now in their 40s, they had filler, and now they say, hey, geez, maybe I should have never done this. What are your thoughts with that? I mean, have you seen people who are coming in and saying, hey, melt all my filler away?
Never.
Not
I completely disagree with this whole part of the article, and I'm just being totally honest. Yeah. So I'm one of those people that have been putting filler in my own face I'm 50, and I've been doing it
your
since
own face.
but I mean, even if I have someone else doing it, I have had filler put in my face since I was in my 20s. We were practicing on each other and whatever. It started. And I'm 50 now, and I've never wanted to have my filler removed. First of all, there's scientifically, like hyaluronic acid fillers are gone in like a year. Your body builds collagen around them.
You've seen some of these MRIs that are coming around where it's lasting much longer than that.
In some areas, but I mean, these are outliers of people putting 20 syringes of filler in someone's faces.
Well, that's, I think, a separate thing. Yeah, let's talk about that too.
But the longevity of the fillers, to me, my understanding of hyaluronic acid fillers is that they absorb, they dissolve much faster than any rate I've ever seen of them sticking around for years. I have patients coming in like, I thought it was going to last like a year, and now I'm looking, I need more, much more so than people saying dissolve it. Can you dissolve hyaluronic acid fillers all these years later? I mean, again, your body forms collagen around it. So like when you inject these fillers, it stretches the skin, it stimulates the collagen producing cells, and you form, some collagen around it. So some of that's kind of a permanent not necessarily the filler that's in there. And there are other fillers that are more permanent that I'm sure people could have removed. But I've never had someone come in years later and say, I regret this.
Yeah.
I've put too much filler in my face. All I ever do is have people coming and saying, I'm addicted. I'd like more. And I try to do a few syringes at a time. I've never done 20 syringes in my life. I know
we'll
it's a
talk
different
about
issue,
that.
but
We'll talk about that.
I don't know. I disagree with this part of the article that long-time filler, I think the opposite. I think if you put little bits of filler over periods of time, it continues to keep you looking very natural as opposed to a dramatic, change in your appearance. That's what I've experienced personally and what I've done for my patients.
I have seen the times I've seen people who have been doing filler for a long time and they've had filler and they are unhappy with it, typically has been tear trough under eye filler.
I agree.
And that I've seen patients who come in, they go, yeah, I've had this done 4 years ago. I have this lump under my eye. It never went away. And so we inject some hyaluronidase into it and they come back 2 weeks later and it's gone.
Yeah.
And they're so happy. And sometimes that filler is like literally 4 years out, and it's still there.
I find that interesting because that is the one area. And lips and tear troughs, I find can sometimes last a lot longer than cheeks and other areas of the face.
I always thought, because I do see that with lips occasionally, and I always thought before all these MRIs were coming out that maybe it's scar tissue. I thought, well, maybe you developed scar tissue because you've had so many injections of the filler, and anytime you break the skin, you're going to create some type of scar there. And so I thought maybe it's just scar tissue sitting there. But now I think we realize that it could actually just be filler that's been sitting there for years.
Yeah.
But it's unpredictable. The problem is it's unpredictable exactly how long it will last for some people. And I do agree that there are certain parts of the face that are more likely to hold it than others. And I get patients too that you inject, they go, yeah, this is Voluma. It's going to last 1.5 to 2 years. And then a year later, it's gone. And you're like, well, okay.
Yeah.
So it's a tough one. I do think that in my practice, I agree with you. I've never had a patient come in and say, just dissolve all of my filler away. I've had patients, I've wanted to dissolve all their filler away.
Same.
They come in, you're like, oh my gosh, how much did you have injected in you? But those patients typically have done that on purpose and they are still happy with it. But I do think that there are some prominent celebrities who have had overdone filler in the past, and we're not going to name them, but everybody's talking about them right now, that I think have had a combination of Ozempic, where they have lost weight, and they've had their fillers removed. They've had them injected, they remove it, and then they probably have been refilled at some point with a more conservative amount of filler. And I do think that may be happening in Hollywood. I agree with you. I don't think that in kind of the general population of people getting injected that I've seen that happen, though. But I do think in Hollywood there are certain celebrities that appears that that's what's been done.
I can see that. If someone's been overfilled or it's not fitting with their body habitus anymore, if they've lost a lot of weight or whatever, I can totally see that. Yeah. And like you said, I've had people that have come in and requested tear trough, under the eyes, be dissolved, occasionally lips, but never have I had someone come in years later and say, never.
Yeah, and
dissolve it all.
Part of it, with the tear troughs, what we're learning is that if you inject filler, especially a hyaluronic acid filler under the eyes, which are the only ones I would recommend anyway, there's a belief that if you're injecting it under the eyes in the tear troughs, that you can disrupt some of the lymphatic drainage from that area. And then people get puffy, they get even festoon-like puffiness down there. And that a festoon basically is puffiness of the orbicularis muscle of the eye. And so it's puffiness not of the eyelid like what I have. This is, if you're watching this, I'm pointing to my lower eyelid, but it's the upper part of your cheek where you can get puffiness there. That is not fat from your eyelid, but that's actually puffiness and fluid that's in a muscle called the orbicularis muscle. That, I think, can occur due to filler, and I almost wonder in those situations, maybe the filler doesn't dissolve as quickly because those lymphatics have been blocked.
Yeah.
And so you're just not getting, the body's natural mechanism of clearing away debris and toxins and all that is not working so well because it's been blocked from that filler. And so because the filler blocks it, the filler maybe doesn't get it evacuated or dissolved away as quickly.
Yeah, possible.
Yeah. Okay, the other thing that they brought up here that we were talking about is this idea of people who are having mega filler in syringes. So there are lifts that people have talked about where you take somebody and they inject a god-awful amount of filler in their faces, and it looks impressive how tight their jawline is afterwards and how the face looks lifted. One of them is called the Y lift. Have you heard of the Y lift? It's a doctor named, I think, Youn Trokel, I think is his name. I think his first name starts with a Y, so I think he calls it the Y lift. I have to look that up, but I'm pretty sure that's what it is. But it's massive amounts, like 10 syringes of filler on each side of the face. And the patients, the changes are impressive. I mean, they look like they've had
Excuse me.
That's okay.
Sorry.
Yeah, that's right. And the changes are impressive. I mean, they look like they have literally had a facelift. And you look at it, it's like, wow, but it's a lot of filler. And he charges, or at least this was several years ago, pre-pandemic, that I went to a meeting and he was talking about it. But he charges a significant amount of money to take his courses so that he can teach you how to do this technique. And so that's kind of, it's a money-making, operation there. Have you seen any, these types of massive filler, mega filler sessions, and have you had doctors try to teach that type of stuff?
No, I have not. I mean, I haven't. Yes, had been at conferences where they've tried to teach those kinds of things, but again, I do a more subtle version of it. I guess I never had really named it or thought about people will say, "Can I have like a liquid facelift?" They've called it like a liquid facelift. I mean, I think the most I've done is 8 to 10 syringes at one time, or at the most. I mean, that's the absolute most.
That's a lot.
And that's a lot, and you can get that's like a serious liquid facelift, but that's the maximum I've ever done. And again, you don't want to overfill. You don't want someone to go from looking one way to looking completely unnatural another. So even if you're someone that's doing 20 syringes, or even if it's 10, 15 syringes, do it in small area, quantities. Like do a few at once and then come back a month later and let it settle and see what it looks like. That's more my philosophy than like slamming somebody with let's lift your whole. And if you want that look, that dramatic effect, go get plastic surgery. That's my take.
Exactly. And for me, when I look at it, if somebody truly wants a ton of volume, then we just do fat, because most people have more than enough fat for us to take. You're going to get more of a permanent result with that. And then I tell them, look, 50% of that fat's going to go away. You're going to end up undercorrected in the end, but then we can touch that up with a little bit of filler afterwards.
Right.
And then you get other patients who come in, they just want a little tweak, then filler's perfect for that. I would not use fat in those patients, because with fat, essentially, you inject it, it puffs everything out, and then you wait as the swelling comes down and the body dissolves some of it away to see what you get.
Yeah.
It's not at all a precise, accurate procedure. Filler is very precise. You can put it exactly where you want it to be and get the exact result. But the problem is it's expensive if you need a lot of it.
Yeah.
And so in those situations, I'll go with fat for patients.
Yeah, I get that. I mean, that makes sense,
The final thing that they talk about is that the Ozempic makeover is the new mommy makeover. And so Ozempic, as you all know, is a weight loss medication, super popular right now. Oh, we got one more thing after this. So super popular right now, and they're saying that that's really pushing a lot of the cosmetic treatments. And I agree. I think that we're going to see more and more in plastic surgery of people who have lost weight and are looking for treatments. I really do think that Ozempic and its sister medications are endemic out in Hollywood. I think that's why we're seeing a lot of these dramatic transformations from celebrities who are in their 30s, 40s, and 50s. But I think it's a combination of Ozempic getting cosmetic procedures, and I also think it's melting some of the fat away, and melting some of the filler away. And I'm actually doing a podcast specifically on that, which actually I just did it yesterday. I think it's going to air. I think 1 or 2 weeks prior to this one.
I can't wait to listen to that one.
Yeah, take a listen to it.
I think it's endemic everywhere, Tony. I think, my patients are coming in oh my gosh, you look like losing a ton of weight. Yeah. And already I'm referring people right and left to plastic surgery because of the excessive skin. Yeah. Because it's really, it's everywhere. And I think it's great. I mean, I think it's for people that have, been struggling. I won't go down that road of why I think it's so great, but I think it's a big trend happening now, because it's really, these are miracle medications for a lot of people. Are you seeing
many of your patients who you feel are using it for losing 10 or 20 pounds versus people who are losing 50, 60, 70? Where
much more for an obesity situation or diabetic or obesity, but it's a common conversation around our office of like, oh, I just want to lose 10, 20 pounds. You think I could just do it for a few months? I mean, I think that's where it's going to be going. I think it's going to...
It's a lot of, the whole Ozempic, it's interesting. We actually covered it in a podcast episode in depth. Let me look that up for you, because it's one of our most popular podcast episodes, actually.
Yeah, they're fascinating medications.
Yeah, with a good friend of mine, Dr. Tina Moore. This is back from September 2nd, and it's about microdosing, big pharma, and weight loss inside the GLP-1 agonist weight loss medication. So if you're interested in learning more about Ozempic and actually how a very forward-leaning physician is using it in microdosing, which is fascinating because it is anti-inflammatory. Really, really interesting stuff.
Yeah.
Okay, the final thing that we want to talk about here today is not quite up your alley, but it's about a new breast implant that will tempt the boob job curious. Motiva is a silicone implant, but is considered a 6th generation silicone implant because of its unique design. It has been used by plastic surgeons internationally for 14 years, but is finally available to U.S. surgeons. The biggest selling point for Motiva is it has a capsular contracture rate of less than 1% at 4 years compared to other silicone implants, whose rate of capsular contracture is about 12 to 19% at 10 years. So this is a huge thing that's been big in plastic surgery, a brand new breast implant. This is the first new breast implant to get approved by the FDA in, my God, I can't even tell you. It's probably been decades. It was an ideal implant that got FDA approval from a company that now went bankrupt. And this one's a company called Establishment Labs that has this new breast implant. This is a big topic that I will cover on an upcoming podcast because I think it does necessitate really getting into the details of it. But if you're interested in learning about it, stick with listening to the podcast. I will have an upcoming episode specifically on that and other of my predictions of what we're going to see in 2025. And so we'll definitely cover the Motiva breast implant at that time because it is, for plastic surgeons who are operating, definitely like the biggest thing that's come around for us in many, many years. And I'll tell you, as of this day right now, I am not putting them in. And we can talk about why in the future. So 2025, we're almost there. Anything that you're seeing that you're excited about for yourself or for your actual practice here that you're thinking about bringing in this coming year?
Yeah, that the exosomes is one. I'm waiting for you to try it first and then see how, maybe be a guinea pig as well. And that's exciting stuff for me is the exosomes.
You're waiting to hopefully sell a device or two on
I
eBay.
might be looking on eBay. So if anyone's interested, check out on eBay in the near future. I may be posting a few devices. I mean, they're still good devices. They're a wonderful device. Cool Sculpting is great. I'm not going to sell that one anytime soon, but we'll see about all therapy. We still have a couple patients that are very loyal to it, but no, the exosome sounds exciting, and nothing else that's really come across. Just the continuation of keeping people looking natural. Fillers, Botox have always been popular with me. No trend up or trend down. So that's
we'll see if people are still doing filler at the end of 2025. According to those plastic surgeons, it seems like nobody's going to be doing it.
We'll touch base about that because I'm going to predict the opposite. I think there's going to be plenty of filler still being done.
And there's some new ones coming out too. So we'll see. There's a lot of new ones on the horizon. You got to wonder with these fillers though. We have so many right now, and each of them have their little niches and stuff, yet they're still coming out with more. I don't know how many more niches you can get with filler. It's just an injection of a gel.
I know.
Well, thank you so much, everybody, for listening. Thank you so much for joining me, Dr.
Thank you
Levin.
for having me. I
love
love being here.
Tell people where they can find you.
Yep, you can find me. I live in my practice is in Bingham Farms, Michigan, called Northwest Dermatology Group, or you can find me online on obviously our website, which is nw-derm.com, or our Instagram, which is northwestderm_Covet Med Spa.
And we'll put a link to all of her information in the podcast caption here, so definitely check that out. Thank you so much, everybody, for watching and for listening. This is Dr. Anthony Youn. I am known as America's Holistic Plastic Surgeon, and this is the Dr. Youn Show. Every week, we talk about these types of hot types of things, and Dr. Levin will be back to join us probably in about another month or so to cover more hot topics. And as always, remember to eat real food, use clean skincare, and autojuvenate before you operate.